Hey y'all.
Hey y'all,
Obviously,
obviously
wish we
wish
could
we
all
could all
be
be
here
here
together
together
in
in
person,
person,
but
but
this is
this is
how it's
how it's
going
going
these
these
days.
days.
So
So
I'm
I'm
really
really
honored to
honored
be
to be
able to
able to
be
be
here
here
and
and
present to
present to
y'all
y'all
this
this
project we
project we
went
went
through
through
at
at
Peak
Peak
Vista
Vista
Peds
Peds
Health
Health
Center.
Center.
And the
And the
whole
whole
premise
premise
of
of
this
this
is
is
really
really
that
that
life
life
is
is
important.
important.
We
We
can
can
intervene
intervene
and
and
be
be
able to
able to
make
make
sure
sure
there's
there's
things in
things in
place
place
as
as
early
early
on as
on as
possible
possible
to
to
make
make
sure
sure
that
that
life is
life is
cared
cared
for.
for.
The
The
best
best
outcomes are
outcomes are
going to
going to
happen.
happen.
We
We
know
know
that
that
prevention's
prevention's
better.
better.
So
So
ultimate
ultimate
prevention
prevention
in
in
life,
life,
let's
let's
look
look
early
early
on.
on.
Babies.
Babies.
Babies are
Babies are
dependent
dependent
upon their
upon their
moms.
moms.
Mom's
Mom's
health
health
begets
begets
baby's
baby's
health.
health.
Postpartum
Postpartum
depression
depression
is
is
considered to
considered
be
to
the
be the
most
most
prevalent
prevalent
and
and
most
most
underdiagnosed
underdiagnosed
obstetric
obstetric
complication.
complication.
Knowing
Knowing
all
all
this,
this,
American
American
Academy
Academy
of
of
Pediatrics
Pediatrics
and the
and the
USPSTF,
USPSTF,
they
they've
put out
put out
all
all
sorts of
sorts of
guidelines to
guidelines to
address
address
screening for
screening for
postpartum
postpartum
depression.
depression.
Okay,
Okay,
so
so
real
real
life,
life,
what's
what's
going
going
on?
on?
Peak
Peak
Vista
Vista
Peds
Peds
Clinic,
Clinic,
they've
they've
been
been
working
working
towards
towards
this
this
even
even
before
before
the
the
AP
AP
put
put
out
out
these
these
recommendations
recommendations
and
and
guidelines.
guidelines.
And
And
they
they
implemented
implemented
a
a
program to
program to
where
where
they
they
are
are
screening
screening
all
all
moms
moms
at
at
the,
the,
or
or
all
all
babies,
babies,
or
or
all
all
moms
moms
at the
at the
baby's
baby's
4-month
4-month
well
well
child
child
checks,
checks,
using
using
the
the
Edinburgh
Edinburgh
Postnatal
Postnatal
Depression
Depression
Scale.
Scale.
They
They
switched
switched
to
to
the
the
EPDS-3
EPDS-3
after
after
their
their
first
first
year,
year,
which
which
has
has
been
been
shown
shown
to
to
have
have
a
a
greater
greater
level
level
of
of
sensitivity
sensitivity
and
and
also
also
has
has
less
less
questions
questions
and
and
is
is
more
more
easily
easily
implemented in
implemented
a
in a
busy
busy
setting
setting
such as
such as
theirs.
theirs.
Um,
Um,
so
so
then
then
really
really
going
going
forward
forward
from
from
here,
here,
knowing that
knowing that
this
this
is
is
already
already
in
in
place,
place,
the
the
big
big
aim
aim
really is
really is
just to
just to
assess
assess
the
the
program that's
program that's
currently in
currently in
place
place
and
and
recognize
recognize
what
what
areas
areas
there
there
are
are
for
for
growth.
growth.
We
We
went
went
about
about
this
this
by
by
first
first
meeting
meeting
all the
all the
important
important
key
key
team
team
members
members
who are
who are
absolutely
absolutely
amazing and far too
amazing, far too
numerous to
numerous
name
to name
everybody.
everybody.
Big
Big
key
key
ones,
ones,
Dr.
Dr.
Rahaman,
Rahaman,
Shay,
Shay,
and in
and in
addition
addition
to
to
that,
that,
Bridget
Bridget
and
and
Winnie
Winnie
at
at
bioinformatics
bioinformatics
were
were
absolutely
absolutely
crucial
crucial
in this
in this
process.
process.
We
We
went
went
through
through
workflows, we
workflows, we
talked
talked
about the
about the
process of
process of
getting
getting
there,
there,
and
and
then
then
really
really
dug
dug
through
through
and
and
really
really
went
went
through a
through a
lot of
lot of
queries to
queries
be
to be
able to
able to
gather the
gather the
data.
data.
And then
And then
after
after
that, I
that, I
went
went
through
through
and
and
did
did
some
some
specific
specific
chart
chart
reviews
reviews
on
on
some of
some
the
of the
moms that
moms
had
that
the
had the
highest
highest
scores.
scores.
You
You
guys
guys
can
can
see
see
here
here
in
in
all the
all the
graphics
graphics
what's
what's
going
going
on.
on.
Big things in
Big things in
summary that we
summary
can
that we
take
can
away
take
from
away from
this
this
are
are
the
the
prevalence
prevalence
of
of
postpartum
postpartum
depression,
depression,
of
of
positive
positive
postpartum
postpartum
depression
depression
screenings
screenings
in
in
this
this
Peak
Peak
Vista
Vista
Peds
Peds
clinic
clinic
is
is
higher
higher
than
than
national
national
averages.
averages.
Um, also,
Also,
the
the
amount of
amount of
screening
screening
that's
that's
getting
getting
done
done
is
is
higher
higher
than
than
is
is
seen
seen
nationally
nationally
by
by
programs that
programs
are
that are
touted
touted
as
as
examples as
examples
to
as
how
to
this
how
should
this
be
should be
done.
done.
Some of
Some
the
of the
only
only
settings
settings
where
where
there's
there's
been
been
programs
programs
that
that
have
have
shown to
shown to
have
have
screening
screening
rates
rates
as
as
high
high
or
or
higher
higher
than
than
Peak
Peak
Vistas,
Vistas,
or
or
when
when
this
this
is
is
done
done
in a
in a
controlled
controlled
research
research
setting.
setting.
This
This
really
really
speaks
speaks
volumes to
volumes
the
to the
fact that
fact that
Peak
Peak
Vista
Vista
went
went
about
about
this
this
from
from
a
a
care-first
care-first
approach
approach
in
in
implementing
implementing
this
this
screening,
screening,
and
and
then
then
looking at
looking at
how
how
are we
are we
doing
doing
with
with
it.
it.
Um, I
I
mean,
mean,
given
given
the
the
patient
patient
population
population
they
they
work
work
with,
with,
this
this
is
is
something
something
that
that
they
they
work with
work
a
with a
lot of
lot of
patients
patients
who
who
have a
have a
lot of
lot
the
of the
big
big
risk
risk
factors,
factors,
such as
such as
like
like
teen
teen
moms,
moms,
having
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 economic
economic
struggles,
struggles,
not
not
having
having
two
two
parents in
parents
the
in the
house,
house,
having
having
kids
kids
who
who
are
are
either
either
born
born
early
early
or
or
had
had
complicated
complicated
births.
births.
There's
There's
all
all
sorts of
sorts of
things
things
that
that
add
add
into
into
this,
this,
and
and
Peak
Peak
Vista
Vista
has
has
a
a
high
high
prevalence
prevalence
of
of
all
all
those
those
risk
risk
factors.
factors.
We
We
go
go
down
down
into these
into these
two
two
charts that
charts
you
that you
have
have
down
down
at
at
the
the
bottom
bottom
looking
looking
down.
down.
Those are
Those are
found
found
through the
through
the chart reviews of the moms with the highest screenings, you can really see how similar that plays out and how the services that Peak Vista provided really came into play. And that's something that's huge, is that Peak Vista did not only were there screen and manage, which is a huge thing, but they also did screen and refer, these are two huge things that a lot of really big, well-funded programs are implementing. So really, the big thing going forward from here is that Peak Vista Peds should really continue with the program they're doing, and really the biggest things are to standardize and streamline documentation. And that'll just help to where BI can then query and come up with reports in a much easier fashion and be able to turn these around on whether it be monthly or bi-monthly, quarterly basis to show the clinical team to make changes, and also use that as a basis to be able to advocate for resources and also demonstrate to other Peak Vista clinics that this should be implemented elsewhere, such as family med clinics, where those doctors can be able to provide for the mom's care as well. In summation, like this is a diamond in the rough. Peak Vista is defying odds in doing what they're doing with this postpartum screening program, with this postpartum depression screening program, with the resources and with the the just the overall patient load that they have. It's really pretty remarkable, and I really hope that some of these documentation changes can get put in place with some support in the future, and this program can continue to grow, and these moms and kids continue to get the great care that they get. Thank you. Y'all have a great day. Take care. Bye.